Welcome to the Queen of Hearts podcast. And here's the queen herself, registered dietitian Heather Klug.
Hello, everyone, and welcome to the Queen of Hearts podcast. With me today is my co-host, Bethany DeBrew Adams. Welcome, Bethany.
Hello, Heather, from my house to yours.
Yes, we are doing a remote podcast today because Bethany was diagnosed with COVID last week.
Yeah, I caught the Rona.
Yes.
It caught me, I should say.
It caught you, and we're just trying to be extra cautious right now. So
yes, we don't want to get Heather and her family sick.
Yeah, so that would be appreciated.
Well, I do this for you, so.
Yes, because I know it hasn't been an easy road. Thankfully, Bethany's been able to, manage this at home, so far. But
so far, so good.
But in talks with you, it sounds like it's not fun.
No, I don't recommend it. 0 stars, do not recommend. So,
yeah. All right. So today's podcast is going to be all about depression.
The uplifting topic, right?
Yeah. And October is Depression Education and Awareness Month. And this week, October 4th through the 10th, is Mental Illness Awareness Week.
Yeah.
Okay. And depressive illnesses are serious medical illnesses that affect more than 19 million adults each year. Approximately 12 million women in the United States experience clinical depression each year. So women make up the bulk of that number, it sounds like to me.
Yeah. And I just want to interject for just a second here.
Please do.
There is unknown reason as to why. So don't necessarily think that women have this happen more often than men. It's just diagnosed more often in women. And there can be a lot of different reasons for that.
Okay. Also, 1 in 8 women can expect to experience clinical depression in her lifetime. But even though these statistics are a bit depressing themselves, it's also important to remember that clinical depression is a treatable medical illness.
Yes.
And while it can occur in any woman at any time for any reason, it is not a normal part of being a woman, and it is not a sign of female weakness.
No, it is not.
Today, we are going to discuss what depression is, what it looks like, and what it can mean for women's hearts.
And we also are going to talk somewhat about suicide as well as part of this conversation. And so we just want to warn folks listening that some of what we talk about today might be upsetting or even triggering for some of you out there. So if you or someone you know is having suicidal thoughts, please contact the National Suicide Prevention Lifeline. The number is 1-800-273-8255. And we'll put that number on our Queen of Hearts podcast site. And if you feel as though you or someone you know is in immediate danger of harming yourself or others, please call 911.
Yes. All right, Bethany, how about we start by talking about the symptoms of depression? Many people's idea of how depression looks is based on equating depression with sadness. While it's true that often the most prominent symptom of depression can be pervasive feelings of sadness, there are plenty of women who do not have feelings of sadness who are clinically depressed. That said, here are some of the most common symptoms of depression, but keep in mind that depression, like many other illnesses, looks different in different people.
Yes, and I think before I, talk about this list of symptoms, we tend to have this idea of what a depressed person looks like, and it's like disheveled and weepy and kind of hanging out in the corner of the room and for a lot of people, myself included, there can be what's known as high functioning depressives, where you basically get up, you do your hair and get dressed and you go to work like any other normal day and you don't look any different. You're not crying, you're not whatever. And I think it's important for people to understand that because we can't pigeonhole this idea because we're going to discount a lot of people who might be dealing with depression if we do that.
Yeah.
So just keep that in mind. And this list of symptoms is long, but you definitely don't need to have all of them in order to be considered depressed. So some of the symptoms are obviously a persistent, sad, anxious, or empty mood, feelings of hopelessness or pessimism, irritability, feelings of guilt or worthlessness or helplessness, decreased energy or fatigue, difficulty sleeping, and that can mean everything from insomnia to sleeping too much, waking up early in the morning before you normally would, those kinds of things. Loss of interest or pleasure in hobbies or activities that you normally like to do. Moving or talking more slowly. Feeling restless or having trouble sitting still. Difficulty concentrating or remembering or making decisions. For me, the making decisions one was always a big component of my depression, feeling that overwhelmed feeling and not being able to like decide on a cereal at the grocery store. Just
Oh, for something simple.
something simple, yes.
Okay.
Changes in appetite or weight, and that could mean everything from eating more than you normally do and gaining weight to not eating at all and losing weight, not having an appetite. Aches or pains, headaches, cramps, or digestive problems without a clear physical cause that do not ease even with treatment. And that sometimes is seen a lot in children or younger people who don't have the ability to articulate what they're feeling. It might manifest itself as these physical problems.
That one's interesting, and I don't think people would think about that one.
Yeah, and it's also too, if you yourself don't feel able to tell other people what's wrong with you, sometimes it's easier to communicate a physical malady than it is a mental one too.
Yeah.
And then, of course, thoughts of death or suicide attempts is also included in there. And like I said, you don't have to have all of them because it's a pretty big list of symptoms. But if you're noticing more of these than than you've ever experienced, that might be a red flag for you.
Okay, let's talk next about how depression can be different in women. Women tend to experience depression at about twice the same rate as men.
Mm-hmm.
And there are 4 different factors that can impact women's mental health. So we're going to go through those. Do you want to start with the first one, Bethany?
Yes. Let's start with developmental differences. So we know that girls reach puberty before boys do.
Mm-hmm.
And it's interesting because of this, they're more likely to develop depression at an earlier age than boys do as well. And there's evidence to suggest that this kind of gender gap then continues throughout life. And when we talk about developmental differences and puberty, we'll get into hormones in a little bit, which is kind of its own category.
Okay.
But this is more kind of like the major physical changes that happen to girls. Girls, we all have been there when we go through puberty and develop breasts, get our periods. Those are things that are kind of obvious and difficult to hide from people. And there's kind of a sexualization sometimes that goes on with young girls that they may not be equipped to handle. There's a whole lot of stuff that goes along with developing in this puberty age that can be very emotionally taxing, we'll just say, for young ladies.
Yeah, and then the second factor are reproductive differences.
Mm-hmm. Yeah, so Heather, I don't have any children. You do.
Yeah, I had 2.
Yeah, so you know that there's dramatic hormonal changes that happen during pregnancy.
Oh, yes.
Yeah.
Very much so.
And those can definitely affect your mood. I'm guessing.
It was a while ago, but yeah, I think I do recall that.
So there's also other issues that can increase the risk of developing depression during pregnancy or during, the times where you're trying to become pregnant. Mm-hmm. And those can include previous episodes of depression, or if you've had children before, having postpartum depression, or even experiencing PMDD, which we'll talk about in a few minutes.
Mm-hmm.
Miscarriage, or infertility. Those can be very traumatic
Oh, yeah.
for women. So that can lead to bouts of depression. And then a lot of women who are trying to get pregnant or become pregnant have to stop their antidepressant medication. And that can also lead to these feelings of depression for
Yeah.
women as well.
Right. Okay. And then the third factor that can impact women's mental health are hormonal differences.
Right. So
And it's not just puberty and pregnancy, right?
exactly. Well, we're women. We know that hormones are, our hormones are kind of interesting creatures to deal with. So there's three main issues that we kind of look at when it comes to hormones. The first is something called premenstrual dysphoric disorder, or PMDD, like I mentioned just a couple minutes ago. And that is a less common and more severe form of PMS, which to me sounds terrifying because I have PMS and it's awful. And I think it's
Mm-hmm.
gotten worse the older I get. So PMDD is a serious condition and it has disabling symptoms for a lot of women, such as irritability, anger, depressed mood, sadness, suicidal thoughts, appetite changes, bloating, breast tenderness, and joint or muscle pain. None of that sounds like any fun whatsoever to
No,
have
not at
to
all.
deal with. So there's that. Then there's what's known as perimenopausal depression. And the risk of depression may increase during this, the perimenopausal period, which is the transition to menopause. And that
Mm-hmm.
can last anywhere.
10 years.
Yeah, it can last 10 years. So fun.
Yay.
And during this time, women's hormones may fluctuate erratically and it can be a hot mess. And
Mm-hmm.
naturally, that can affect your mental health. Imagine that.
Yeah. Yeah.
And then there's also menopausal or postmenopausal depression. So once you actually transition through menopause and you're now, which is when your period actually has stopped for a year, that's considered menopause, the depression risk may increase once that happens because now you have a significant reduction in estrogen.
Mm-hmm. Mm-hmm.
So that can mess with your brain a little too.
Right. Now, the fourth and last factor that can impact women's mental health are a variety of social factors. So
Mm-hmm.
let's go through those.
Definitely. And I think we tend to think about, okay, women have to deal with all this hormonal stuff. No wonder they have are having mental health issues. But society and social factors are a huge part of this as well. So the first one is women, let's face it, we have unequal power and unequal status in society. Women
Mm-hmm.
are much more likely to live in poverty than men, and this can cause concerns such as uncertainty for the future, decreased access to community and healthcare resources. And these types of issues can cause feelings of negativity, low self-esteem, and lack of control over life. Women don't make as much money as men for the same work. There's a whole, a
Yeah.
whole host of issues that kind of put us back and hold us back and make things a little more difficult for us mental health wise.
Right, right. The next social factor is work overload. And
Mhm.
I think most women can probably relate to this one quite a bit
Mhm.
because often women work outside the home and then they come home and they still have all these home responsibilities too.
Mhm.
And many women deal with the challenges of being a single parent. Maybe
Right.
they work multiple jobs to make ends meet. And then women are the caretakers, right?
Mhm.
So, we're caring for our own family members, maybe children, but then also older family members, often all at the same time. A lot to kind of take on,
Yeah,
right?
exactly. And the final aspect in the social realm is sexual or physical abuse. And October is also Domestic Violence Awareness Month. So
Mm,
this fits in actually very well with our conversation. Women who are emotionally, physically, or sexually abused as children or adults are more likely to experience depression at some point in their lives than those who weren't abused. I don't think that's a surprising statement to make.
right, right.
And women are more likely than men to experience sexual abuse. So that's going to put women at more of a risk for developing depression than men as
Right.
well.
Now, Bethany, since we are a podcast for women and heart health, this next
Mm-hmm.
part we're going to talk about is very interesting, and it's the impact of depression on women's hearts.
Mm-hmm.
And there's thought to be a two-way relationship between heart disease and depression.
Right. So the
Yeah.
first part of that two-way relationship that we're going to talk about is there's a percentage of people with no history of depression that are going to become depressed after a heart attack or after developing heart failure or other cardiovascular disease. So for people with heart disease, this means depression can increase the risk of an adverse cardiac event, such as a heart attack or blood clots. I know we mentioned in a prior podcast where we were discussing mental health that depression can make the platelets in your blood stickier than in just
Mm-hmm.
the average person's blood as well, which can lead to atherosclerosis. Hard one to
Yeah.
get out.
Yeah.
So,
And that's, again, stiffening of your arteries.
right,
Hmm. Also, the continued presence of depression after recovery increased the risk of death to 17% within 6 months after a heart attack, as opposed to 3% for a patient who didn't have depression. So
yeah,
that's pretty significant right
yeah,
there. Yeah.
that's a marked increase.
Yeah. And then patients with heart failure and depression have an increased risk of being readmitted to the hospital and also have an increased mortality risk.
Right. And heart failure is one of those conditions where a lot of how well you do with it depends on how well you're taking care of yourself outside of a hospital situation. And there is a lot of responsibility put on the patient for,
Yeah.
maintaining their care. You have to monitor the salt in your diet. You have to monitor the water in your diet. You have to make sure you're getting exercise. And those things are all difficult usually for people who are suffering with depression. It's harder to be compliant with a lot of those behaviors.
Hmm. Yes.
So the second aspect of this two-way street is people with depression but no previously detected heart disease seem to develop heart disease at a higher rate than the general public.
Yeah. And people with depression have been shown to have increased platelet reactivity, like you were mentioning before, Bethany, the blood platelets kind of sticking together.
Mhm.
They also have decreased heart variability. And then there's increased pro inflammatory markers, which are all risks for cardiovascular disease.
Mhm.
For people who do not have heart disease, depression can increase the risk of heart attack and development of coronary artery disease also.
Mhm.
And then we go into like some of the lifestyle stuff. So, negative lifestyle habits associated with depression, like smoking, excessive alcohol consumption, maybe lack of exercise, poor eating habits, and then also lack of social support. All of those things interfere with the treatment of heart disease too, right? So it's
Right.
almost like a double whammy. It's like you got the depression, which impacts your hearts in certain ways, but then with the unhealthy habits kind of along with that, it compounds everything and makes it
Right.
even more troublesome.
And it also makes it, depression makes it harder to get rid of some of those unhealthy lifestyle choices that you're making. It makes it that
Yes.
much harder to overcome them. So it's just everything kind of feeds into it, each other.
Yeah.
And in
Yeah.
fact, depression has been proven to be such a risk factor in cardiac disease that the American Heart Association recommended that all patients be screened for depression. And they do this by using some simple screening questions and an easy survey that's called the Patient Health Questionnaire. I think it's like 6 or 7 questions. And obviously, it's by no means, perfect, but it's not necessarily it's not treatment. It's just kind of like, hey, this person might be at risk for depression or might be starting to go down that road. We need to deal with this right now so that you can have the best benefit and best outcome for your heart as you move along in your treatment plan.
Yeah. All right. This next topic is not fun to talk about, but it is very, very important, and that is suicide.
Right.
It's important to note that while suicidal ideation may be a part of depression, it isn't always. It's also important to note that many people who have untreated depression for whatever reason can feel suicidal, and it can happen in people with other mental illnesses or no mental illness at all. And if we go back and look at statistics, suicide rates have steadily increased over the past several years, approximately a 30% increase from the years 2000 to 2016. And although this increase was seen in both sexes, women had a notably steeper rise in suicide rate during this time. It was a 50% increase.
Wow.
And increases were seen across all age groups. However, the age group with the highest suicide rate is women aged 45 to 64.
That's us, Heather.
I know, like we're just kind of in there now. So,
Well, and it's kind of like we were talking a little bit about this before we started recording, and it's kind of like this age, 45 to 64, you're still parenting your own children. You're also probably, if not fully taking care of aging parents, you are participating in their health stuff that's going on as well. You
mhm,
know, you probably have some issues of your own that you might be dealing with. Your spouse may have issues of their own that they're dealing with, and your kids may have those kinds of things. You've got work because you're still working.
yeah,
It's so much going on, and then right now you add 2020 to this,
yeah,
and it's easy to see how this can all kind of become too much. And that's where we want to talk about suicidal ideation. So, what is suicidal ideation? Well, strictly speaking, it means wanting to take your own life or thinking about suicide. And there are two types of it. And before I get into them a little bit, it's important to know that one is not necessarily any less serious than the other. So the first type is called passive suicidal ideation. And this occurs when you wish you were dead. You're thinking this to yourself, or that you could die, but you don't actually have any plans to commit suicide. It's just more of an abstraction in your
mhm,
mind. And then there's active suicidal ideation. And this means not only thinking about suicide, but having the intent to commit suicide, including planning how to do it, obtaining the means to do it, those kinds of things. And both of them are dangerous because you can go from passive ideation to active ideation literally, like that.
right,
It's
right.
not like it necessarily takes a long time. So it's important to know that if somebody is thinking about it and they might articulate that to you, that is a serious situation to deal with as well. So,
Right. So let's talk next about how being a woman impacts suicidal tendencies.
yeah, you wouldn't necessarily think that gender would have much to do with it, but women are roughly 3 times more likely to attempt suicide, even though men are 2 to 4 times more likely to die by suicide. And women also show higher rates of suicidal thinking, non fatal suicidal behavior, and suicide attempts. So, without getting too deep into the research on this, because there's so much and it's so broad and it encompasses so much, there's a number of different theories as to why there's the gender differences in suicide, but there's nothing that's been released that's definitive.
Hmm.
So, there's some schools of thought that say, okay, the reason that women aren't as successful if they are trying to die by suicide is because the methods they choose are not as lethal as the methods men choose. There's schools of thought saying that there's a vanity aspect as to why women would choose something like an overdose versus a gunshot wound, where they feel as though they, want to preserve how they look,
Hmm.
either for themselves or for their children, or, those kinds of things. There's also a school of thought that says women choose these, quote, less lethal methods because they're not 100% committed to dying. They would rather have somebody see them and, help them. And that's the only way they can reach out for help. So, there's all of these different ideas. None of them have been proven to be 100% true. So the differences in attempts and completed suicides in women have led many people to falsely believe that suicide attempts in women are often just a method of gaining attention rather than a serious risk. And this
Hmm.
is not true. This is a complete and utter fallacy.
Right.
Among women, an attempted but failed suicide attempt is the greatest risk factor for suicide in the future. And because of that, all attempts need to be taken seriously.
Correct. Yes.
Yeah.
That's very good to point out.
So, yeah, there's gender differences. We don't know exactly why they exist.
Okay. Let's talk next about how heart health impacts suicidal tendencies. So there's
Hmm.
4 things we want to cover here. So the first one in 5 people hospitalized for a heart attack or chest pain develop major depression, and that's a risk factor for suicide.
Yes.
Yeah. Number 2, suicide death rates in patients with cardiovascular diseases peak early, right after diagnosis of acute myocardial infarction. So that's a heart attack, ischemic stroke, or hemorrhagic stroke. So that one you're focusing more on right after the diagnosis.
Hmm.
This next one in patients with chronic cardiovascular disease with congestive or chronic heart failure and pacemaker implantation, suicide death rates increase progressively over time.
See,
So,
that's interesting to me. Not so much the congestive heart failure, just because, like we said, that's a lot to have to
oh, yeah,
manage. But
yes.
the pacemaker implantation, that
Yeah,
one is a little surprising to me.
I
I
don't know
didn't.
unless you're constantly worrying that your heart's not going to work like it should. I
Yeah,
don't
I
know.
suppose that could
You
be
know, I don't know. But anyway, with that one, over that period of time that somebody has that condition, you need to be really concerned about that.
right.
And then there are certain life situations having to do with a cardiovascular diagnosis that can impact suicidal ideation as well. Do you want to go through those, Bethany?
Yeah. So, and these are things that can affect people with depression or without. One of them is loss of health, and that can be a real or imagined loss of health. That means that could be anything from your doctor telling you you have 6 months to live to your doctor telling you, okay, your blood pressure's gone up a little bit, and we'd like to start it on some medication and a diet plan. And you have this calamitous thinking that your life is over because of this particular diagnosis.
Mm-hmm.
Also, the first week after discharge from a hospital, and that can be for any type of illness, for any issue that you come out of there for it.
Mm-hmm.
And then just before and after a diagnosis of a major illness. Obviously, it can be a lot of information, a lot to process, and people can be very overwhelmed. And that's a period of time that you just kind of want to be aware of.
Right. So some people out there might be thinking, well, how can I tell if someone is feeling suicidal? There are quite a few warning signs that may be present. So let's go through those.
Yeah. So some of the warning signs, and again, this is one of those things where they might not all be present. There might be none of them present. It's just
Yeah.
important to kind of bear in mind that. So some of these symptoms are depression, obviously, as we've been talking about, previous suicide attempts, even in the past, like the far past, preoccupation with death, statements like, you'd be better off without me, or I wish I were dead, talking openly about wanting to kill oneself, development of a suicide plan, acquiring the means to carry it out, rehearsal behavior, or setting a time for an attempt, making out a will or giving away favorite possessions. And this is another one we kind of talked about. It's very different when you have somebody who's advanced in age
Mm-hmm.
or who's, coming to the end of their life naturally, who's doing this behavior, and somebody who seems very healthy otherwise and robust.
Mm-hmm.
Inappropriately saying goodbye, like if you normally see somebody 5 days a week and they're kind of going overboard with the goodbyes, that could be a red flag. Making ambiguous statements like, you won't have to worry about me anymore, or I wish I could go to sleep and never wake up, or I just can't take it anymore. And then the final one is suddenly switching from being very depressed to being very happy or calm for no apparent reason. And this tends to be because if somebody has has been depressed for a long time and creates a suicide plan, once they have the plan in place and they have the means and the, ability to carry it out, a lot of people in this situation get a sense of euphoria, get a sense of calm. They're happy to know that this will all be over soon. And I think to loved ones or to people who are kind of aware of the fact that this might be going on, it almost seems like a, whew, okay, they're feeling better moment. And it can actually be a the beginning of that choice in the end, So that's something to be aware of. And again, like I said, these symptoms may not even be present. So if something happens and someone you care about and someone you know very well ends up dying by suicide, the important thing to remember is, if they didn't articulate to you why they were making that decision, you can't blame yourself for missing something.
Yeah.
There's
I think a lot of people do that. Yeah.
Yeah, it's human nature. And I think it's hard to believe that you couldn't have stopped it, but sometimes that's just how it works out. And it's not good to beat yourself up about a situation that was out of your control.
Okay. All right. So the last thing we're going to talk about is really, what do we do if we think someone is feeling like they're going to commit suicide?
Right. I mean, obviously, this is one of those times where communication is very important. Talk to them and talk with compassion and kindness. Be aware that this person might feel very defensive. They may deny that they're feeling like dying by suicide. I mean, it's a very tough topic to talk about, and it's a very tough thing to admit to people. So our tendency as humans is to be like, I would never think that way. Are you kidding? Come on, that's nuts. But, just put it out there that I care about you. I'm concerned about you. I know things have been rough lately. How are you doing? What can I do to help? Don't discount their feelings. Express that you care about them. And I mean, you don't want to push too hard, and browbeat somebody. But it's important to open up that line of communication. And if the person is in immediate danger, if you feel like they are a danger to themselves, it's important to reach out to professionals as soon as you can. Don't leave the person alone if you believe they are in immediate danger. You can call 911. You can go to the emergency room. Now, emergency rooms have a little different protocol because of COVID-19 that's going on. So it might be a little more complicated, or not, if not complicated, just a few more hoops you have to jump through, right? I would say, to get into the emergency room. But the hospitals understand that a mental health crisis is a health crisis. And what they want to do is prevent that person from harming themselves. So,
yes. Well, all right. So that was a lot to cover today.
I know.
On depression and mental illness. And these are very trying times, I think, for everybody. But the more tools we have to understand depression and mental illness, the more we can really bust the stigma of these conditions.
Definitely.
So, thank you so much for listening in today, everyone. And as we always say, be the ruler of your own heart. Goodbye.
Bye-bye.
Thank you for joining us on the Queen of Hearts podcast. Our podcast is recorded here at the Karen Yance Women's Cardiac Awareness Center inside Aurora St. Luke's Medical Center in Milwaukee, Wisconsin. For more heart-healthy tips, info, recipes, and more, visit our website at www.karenyancecenter.org. Like us on Facebook at Karen Yance Center, and follow us on Pinterest. If you like what you hear, subscribe to our show and be sure to tell your friends. Until next time, ladies, be ruler of your own heart.